Infant reflexes drive movallali. What are infant reflexes? Involuntary stereotyped movement responses to a particular stimuli. Dominant movement formed during the last 4 months of prenatal life and first 4 months after birth. Occur subcortically, below the level of the higher brain centers. Infant versus lifespan reflexes. Most infant reflexes do not last beyond the first year. Infant reflexes may not completely disappear. May be inhibited by maturing CNS. May be integrated into new movements. Reflexes that endure are called lifespan reflexes. Examples? Infant reflexes are very important in the process of development. Why is the study of infant reflexes important? Dominant form of movement for last 4 months prenatally and first 4 months postnatally. Primitive reflexes critical for human survival. Postural reflexes believed to be foundation for later voluntary movements. Appearance and disappearance helpful in diagnosing neurological disorders. Role of the reflexes in survival. Human infants essentially helpless. Highly dependent on their caretakers and reflexes for protection and survival. Primitive reflexes occur during gestation or at birth and most are repressed by 6 months of age. Primitive reflexes are important for protection, nutrition, and survival. Examples? Role of reflexes in developing future movement. Postural reflexes are related to the development of later voluntary movement. Reflexes integrated, modified, and incorporated into more complex patterns to form voluntary movements. Automatic movement is practice for future voluntary movements. Some believe reflexes may not be related to future motor development. Examples? Role of reflexes in developing future movement. Infant reflex. Future voluntary movement. Crawling. Labyrinthine. Upright posture. Palmar grasp. Grasping. Stepping. Walking. Reflexes as diagnostic tools. Reflexes can determine level of neurological maturation. Reflexes are age-specific in normal, healthy infants. Severe deviations from normal time frame may indicate neurological immaturity or dysfunction. Reflexes should be tested carefully and only by trained professionals. Need state of quiet. If baby restless, crying, sleepy, or distracted, may not respond to applied stimulus. Reflexes as diagnostic tools. Concern. Moro reflex. May signify cerebral birth injury if lacking or asymmetric. Asymmetric tonic reflex. May indicate cerebral palsy or other neurological problem if persists past normal time. Reflexes as diagnostic tools. Milaney-Comparetti neuromotor development examination. Measures several infant reflexes from birth to 24 months. Develops profile of child's movement in relation to what is expected at a specific age. Especially valuable with children suspected of motor delay. Reflexes as diagnostic tools. Primitive reflex profile. Quantification of the level of presence or strength of primitive reflexes. 3 reflexes: Moro, asymmetric tonic neck, symmetric tonic neck. 5-point classification system: 0 for absent, 4 for so strong it dominates individual. Pinpointing the number of infant reflexes. Different terminologies used for same reflex by experts. Routing reflex equals search reflex, cardinal points reflex. Reflexes are often poorly defined and more complex than once thought. Palmar grasp versus traction response. Primitive reflexes: Palmar grasp, sucking, search, Moro, startle. Asymmetric tonic neck. Symmetric tonic neck. Plantar grasp. Babinski. Palmar mandibular. Palmar mental. Primitive reflexes palmar grasp. Stimulus, response. S, palm stimulated R, forefingers, not thumb, close. Duration. 5 months gestation, 4 months postpartum. Concerns. No palmar grasp may indicate neurological problems, spasticity. Other. One of the most noticeable reflexes may lead to voluntary reaching, grasping. May predict handedness in adulthood. Primitive reflexes sucking. Stimulus, response. S, touch of lips R, sucking action. Duration. In utero, 3 months postpartum. Concerns. No reflex problematic for nutrition. Other. Often in conjunction with searching reflex. Primitive reflexes search. Stimulus, response. S, touch cheek R, head moves towards stimuli. Duration. 6 weeks prenatal, 3 months postpartum. Concerns. No reflex problematic for nutrition. No reflex or a lack of persistence may be sign of CNS or sensory motor dysfunction. Other. Often in conjunction with sucking reflex. Contributes to head/body righting reflexes, primitive reflexes Moro, startle. Stimulus, response. S, suddenly but gently lower baby's head S, head suddenly shifts position. Startled by a sudden noise R, arms and legs extend. Duration. Prenatal, 4 to 6 months postpartum. Concerns. May signify CNS dysfunction if lacking. May signify sensory motor problem if persists. May delay sitting and head control if persists. May indicate injury to one side of brain if asymmetrical. Other. Reaction time increases with age precedes startle reveal. Primitive reflexes Moro. Bilateral absence of the reflex may mean damage to the infant's central nervous system, while a unilateral absence could mean an injury due to birth trauma. Erb's palsy or some other form of paralysis is also sometimes present in such cases. Primitive reflexes startle. Stimulus, response. S, same as Moro R, arms and legs flex. Duration. 2 to 3 months after Moro disappears, 1 year. Other. Less severe startle reflexes elicited through lifespan. Primitive reflexes asymmetric tonic neck. Stimulus, response. S, prone/supine position, turn head to one side R, limbs flex on one side, extend on other side. Duration. After birth, 3 months. Concerns. Facilitates bilateral body awareness. Facilitates hand-eye coordination. Other. Also called bow and arrow or fencer's position. Asymmetric tonic neck. When the child's head is turned to the side, the arm on that side will straighten and the opposite arm will bend. If reflex continues, 6 months of age, a disorder of the upper motor neurons. The tonic neck reflex is a precursor to the hand/eye coordination of the infant. Primitive reflexes symmetric tonic neck. Stimulus, response. S, baby sitting up and tip forward R, neck and arms flex, legs extend S, baby sitting up and tip backward R, neck and arms extend, legs flex. Duration. After birth, 3 months. Concerns. Persistence may impede many motor skills and cause spinal flexion deformities. Primitive reflexes plantar grasp. Stimulus, response. S, touching the ball of foot R, toes grasp. Duration. Birth, 1 year. Other. Must disappear before the baby can stand or walk. Issue of shoes versus no shoes. Primitive reflexes Babinski. Stimulus, response. S, stroke bottom or lateral portion of foot R, great toe turns downward. Duration. Birth, 4 months. Concern. Test of the pyramidal tract, i.e. ability to perform conscious, voluntary movement. Primitive reflexes. Palmar mandibular. Stimulus, response. S. Pressure to both palms or hair to hand. R. Eyes close, mouth opens, and/or neck flexes, which tilts the head forward. Duration. Birth, 3 months. Other. Also called the Babkin reflex. Primitive reflexes. Palmar mental. Stimulus, response. S. Scratch base of palmar, lower jaw opens and closes. Duration. Birth, 3 months. Postural reflexes. Stepping, crawling, swimming, head and body righting. Parachuting. Labyrinthine. Pull-up. Postural reflexes. Stepping. Stimulus, response. S. Infant upright with feet touching surface. R. Legs lift and descend. Duration. After birth, 5 to 6 months. Concerns. Essential forerunner to walking. Other. Sometimes called walking reflex. Developmental changes in reflex over time. Postural reflexes. Crawling. Stimulus, response. S. Prone position on surface, stroke alternate feet. R. Legs and arms move in crawling action. Duration. Birth, 3 to 4 months. Concerns. Precursor to later voluntary creeping. Postural reflexes. Swimming. Stimulus, response. S. Infant held horizontally. R. Arms and legs move in coordinated swimming type action. Duration. 2 weeks after birth, 5 months. Other. Recognition of reflex led to popularity of infant swim programs. Postural reflexes. Head and body righting. Stimulus, response. S. Supine, turn body in either direction. R. Head rights itself with the body. S. Supine, turn head in either direction. R. Body rights itself with the head. Duration. Head: 1 to 6 months, body, 5 months 1 year. Concerns. Related to voluntary rolling movements. Postural reflexes. Parachuting. Stimulus, response. S. Off balance in upright position. R. Protective movement in direction of fall. Duration. 4 months, 1 year. Concerns. Assessed in preterm babies as markers of neurological development related to upright posture. Other. Also called propping reflex. Occurs downward, sideways, and backward. Postural reflexes. Labyrinthine. Stimulus, response. S. Baby held upright, tilted in one direction. R. Baby tilts head in opposite direction. Duration. 2 to 3 months, 1 year. Concerns. Related to upright posture. Other. Also considered primitive reflex. Postural reflexes. Pull up. Stimulus, response. S. Sitting/standing, hold hands, tip in one direction. R. Arms flex or extend in to maintain upright position. Duration. 3 months, 1 year. Concerns. Related to upright posture. Reflexes disappear or inhibited by the frontal lobes as a child moves through normal child development.